Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Nita, I can't hear you. Are you with me?
I am with you.
You want me to take over?
I am with you. You can't hear me? Can you hear me now?
I can hear you now.
Yay! I didn't mean to ghost you. It was just a little holiday trick, I think.
All right, that's good.
So, how are you?
Why don't you tell us what the show is about, Nita? I'm living it up.
Oh, you were okay. Well, that's good. I just had to make sure that you were living it up because we want our listeners to live it up. And what the show is about basically is orthopedics, musculoskeletal pain, and how to heal your pain with regenerative medicine. That means rebuilding the tissue, quite literally, as opposed to most elective surgeries. How am I doing so far?
A little slow, but I'll put up with it. We still love you.
All right, let me cut to the chase. What we want for you to do as a listener today, we want you to call the program right here, right now at 866-870-5752 and get Dr. Darrow's latest book for free. This is a very big deal. It took him 5 years to do the research and write it. The title is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies. The foreword is written by Suzanne Summers, the actor, and Dr. Darrow appears in her book, A New Way to Age. So that number again is 866-870-5752. Get your free book right here, right now, because it's worth it to see an alternative to the pain you're having. We don't want you to continue to live day after day, week after week, month after month, year after year in chronic pain.
I'm going to take you out of your pain right now, Nita.
Thank you so much.
I'm going to go to a quick question.
Awesome.
All right, so I get emails from all over the world, and I do emails when I wake up in the morning, in between patients every day, at night when I get home. I love communicating with people, and as you folks who are listening who know me, past patients and friends and whatever, I give every single patient my cell phone number when they come in and my email address. So if a patient needs to get a hold of me, they can do that anytime they like. If I'm asleep, I tell them they can call. It's not going to bother me because I turn off my phone, but I'll get back to them when I wake up. Okay, so this person says, hello, I'm from Iran. I have a shoulder problem. Dislocated repeatedly shoulder about 15 times, and now the doctor said I have to have an open surgery. Can you fix it with stem cell injection? If it's possible, please let me know as soon as possible. All right, so a couple issues come up here. Yes, I treat people with shoulder dislocations all the time and help heal that up. There is a surgery or different surgeries that can be done to tighten up the capsule on the shoulder, and sometimes those fail. So you go through a surgery to stop the dislocations. I have a lot of patients that come in after that surgery, and they still have the same problem. So what I do is not invasive. We use injections. We take platelets from your blood and stem cells, if you like that, for a better healing, quicker healing. And we can just inject that. It's very simple. We don't have to cut the body open. This particular email says the doctor wants to do an open surgery. That means that you use a scalpel, open up the skin, and then do whatever work is done in there and then suture it back up. Now, a lot of people think if they get an arthroscopic surgery, that's one where a camera is put into the shoulder or other part of the body to look and use small tools with small holes. And they go, well, it's not an open procedure, so it's okay. It doesn't matter. I'm against these elective procedures, these elective surgeries. I had one on my shoulder when I was in medical school, and I was an orthopedic dummy at that point. And I do say a dummy because the shoulder surgery I had, which was arthroscopic, meaning it wasn't cut open, it was just poked some holes in it, came out terrible. And I awakened with an arm that was full of fluid, and eventually later that day I had a high fever, and it came out bad, came out real bad. My arm was, and my shoulder was in a lot of distress, and that was, that was about fourth year of med school. And then it wasn't until my residency at UCLA that I learned about doing regenerative medicine, and I injected my own shoulder, and that's just poking it, with a needle, small needle. And I healed myself up overnight after, I think it was about 4 years of misery after that failed surgery. So be careful if you're going to get a surgery. If it's not an emergency, if it's elective, that means you get to decide whether or not to do it. And I would definitely, in my experience and seeing thousands and thousands of patients over the years, we get most people better just doing injections with their own cells from their body, called PRP or stem cells, or both mixed together. So I wouldn't jump into a surgery if I were you. Of course, if you want to, you can. But a lot of people come in who have had failed surgeries, and then we do our regenerative procedures and heal them up when that failed surgery didn't work. So I would be very careful. I'm going to give out the phone number to the studio. We're live right now. You can call me and ask questions about this. And Nita, you're making a lot of noise over there, so back up. The phone number...
Oh, I forgot to stop breathing. I'm sorry.
No, you're clicking and smacking your lips. The phone number to the studio live right now is 866-870-5752. I'll repeat it for you. It's 866-870-5752. And if you want to reach someone at the office, there are people on the phones now to get more detailed information if we miss it on the show. That's to the studio is 866-870-5752 to talk to Anita and I live. And if you want to call the office, there's Dr. Marc Darrow at 800-300-9300. That's 800-300-9300. And if you're interested in making an appointment, you can use that number. And if you want to watch videos of me doing these procedures, which I've done on myself many times, I've injected my knees and my shoulders, my elbows, my wrist, whenever I get injured, which I have done over the last 25 years or so a few times, because I am a repetitive athlete. I do things over and over till I perfect them. Not that I ever really perfect them, but I'm always on the track of wanting perfection in sports. So the website you can go to and actually watch these videos, and that is www.lastemcells.com. That's www.lastemcells.com. And I'm going to go to another question right now. And let's see what this one is. This says, pain after meniscus surgery. Boy, I get so many people with that. The person says, I recently had an arthroscopic meniscus surgery due to a tear sustained at work. I'm 3.5 months post-surgery, and my knee hurts worse than prior to the surgery. I hear this story all day long. I've been doing physical therapy, took an oral steroid. I don't like those because oral steroids can actually kill the hips and cause what's called avascular necrosis, where you have to get a hip replacement. So I don't like taking or giving oral steroids. I don't do that to patients. And lastly, an injection of steroids. Whoa. Steroids are not good for the body. And if you look up cortisone, which is the main steroid used, cortisone and cartilage, you will never get one of these injections because it's going to tell you that it diminishes the tissue. It can actually kill the tissue. So I wouldn't do that. But of course, that's just me. It's used widely in orthopedics. And, they don't like me and I don't like them. Let's just put it the way it is. We do different things. Mine is more natural, and theirs is using knives and steroids and medications, and I'm not a fan of any of that. This says, prior to my initial MRI results of an X-ray showed arthritis in both knees, to which he then, that's probably the doctor said, were normal for a person of their age, 46. Since my surgery, every time I have brought up my pain concerns and the swelling and the stiffness and mobility issues, he just responds and says it's due to my arthritis. Well, that's kind of a cop-out there, because regenerative medicine can usually heal the pain of arthritis or meniscal tears. I get people with meniscal tears all the time, and guess who is one of them? Me. I've had meniscal tears in both my knees. I've injected them with platelets and stem cells. I went running with my husky up in the mountains. Bella, she's a good runner. She's fast. And I had no pain doing that. I used to have pain, but after the injections, I got better. Then the person goes, I didn't even know I had arthritis when he x-rayed me. I feel like it's not arthritis, but my concerns are not being addressed seriously. Also mentioned that my entire leg swelled up after the injection, and I now have a knot in the front of my calf, to which he didn't respond. What am I asking for is some direction, or what else may be contributing to my issues, what options I have. I'm really scared that I made a mistake having the surgery. Thank you for your time. Well, I hear this scenario all the time, and it kind of makes me angry, to be honest with you, because the culture of orthopedics is very invasive. It's either doing steroid shots, which is terrible for the cartilage and leads to arthritis, or getting a surgery, which causes immediate arthritis. You take out tissue, and guess what? You've got arthritis. So regenerative medicine is newer on the forefront of medicine. It's actually been around since the beginning of the 1900s, but it doesn't make a lot of money for the system or for doctors, and orthopedics does. So, I always tell people when they ask me questions, follow the money, and that'll give you your answers as to what's going on this planet. Doesn't make me happy, but that's the way it is. If you've got orthopedic issues, neck pain, back pain, joint pain, tendinitis, labral tears, plantar fasciitis, all these different syndromes, I wouldn't jump into a surgery. I'd find a doctor who does regenerative medicine. I've been doing this for 25 years, since my residency at UCLA. I taught these treatments at UCLA to the physical medicine rehabilitation residents there, and I've created a lot of competition because a lot of my doctor students now do this. But you know what? There's not really anything like competition other than something that's good, because it helps push the field further, and I like competition. There's a lot of people that come in after failed surgeries, after failed regenerative medicine, and the regenerative medicine often is done by doctors who don't really know what they're doing. And I always tell people, if you're going to go to a doctor, go to the doctor who does the most of whatever procedure it is you want. Ask them, how many of these did you do today, yesterday, the day before, last week, last month? And if they haven't done a lot, don't go to that doctor for anything. I don't care what it is. I'm going to give out the phone number so you can talk to me and Nita right now live. And that number, or get your pencil, 866-870-5752, 866-870-5752. If you call in, I'm going to give you a copy of my book for free. It's a $25 book. It's got, I'm looking here, close to 200 pages and about 256 studies on how regenerative works very well for orthopedics, and how surgery really is not the way to go anymore unless you have an emergency. So, and that's a question, what is an emergency? A lot of patients come and said, I had to get that surgery. It didn't work out, but I had to do it. And I'm not a believer in the had to do it business, because most people that get orthopedic surgeries don't need to get them. If you've got a broken bone sticking out of the skin, you need to do that. But most people who have pain don't need to have a surgery. And that's been my experience doing this work for over 25 years. The number to the office, if you want to catch someone there, you can call there now, is 800-300-9300. And if you want to reach me, there's a way you can email me on every page of my website. I answer emails all day in between patients. And that website is www.lastemcells.com. We also in the office stimulate hair to regrow using platelets and stem cells. Not going to work for Dr. Phil, who's got nothing up there, but if your hair is thinning, it works pretty good. And then the other thing we do is called the vampire facelift, which is a non-surgical facelift using platelets or stem cells or both to thicken up the collagen on the face. As we get older, our collagen dries up, the face gets gaunt, we get shorter, the discs in our back start to dry out and get smaller, and people shrink. My dad was probably about 6'1", same as me, and before he died, he was shrunk up. He died at 90. I've lost a little bit of height also, and I think a lot of you know what I'm talking about. So, Nita, do you have anything to pipe in with here for us?
We are getting a couple calls in here, and I thought we might talk to Joseph.
All right, let me get to the call screener here and see what's going on with Joseph. Joseph, you've got knee problems. Tell me about it. What's going on?
I'm an old guy, and they said you can expect this. I've been in to my, sports medicine doctor, and I have taken those shots.
Okay.
Because at that time, there was no other option, and I couldn't stand the pain.
Okay.
But
how old, Joseph? How old are you?
Twice.
How old are you?
What?
I'm old?
71.
71?
Yes.
Okay. Well, I'm 74, and I'm a young guy, so it's just your vernacular of what you're talking about.
Well, my vernacular is because I've been in the construction industry.
Well, me too. I've done that too.
It'll tear anybody up.
I know what you mean. I get contractors in every day of the week, and you're right. You guys
that's
get
me.
you get beat up a lot.
I moved out of general construction, and I became a custom cabinet maker, designer, and specialty mill worker.
Wonderful.
But in 2008-9, I had like a lot of square feet, and it all went away because the business went down. I had to put my tools in storage, and then I started doing everything on my own.
Okay. Well, let me respond to this already,
and
okay? I got you.
That time is when that's when I realized, I can't do this anymore.
Joseph, can I ask you some questions and respond?
Yes.
Okay, thank you. Number one, I get people with arthritis in their knees every single day. I think we do more knees than anything else, although I do the entire body. I had a gentleman come in yesterday who was a jiu-jitsu fighter, and his whole body was racked up. I had to do ribs all over his back and his chest. And, I do a lot of places that most regenerative medicine doctors don't, because whatever you need done, I can do it. Any part of the body from the head to the toe and everything in between. But knees are probably the most common thing. And I get people that come in every day that say, I can't take it anymore. I had to get that surgery. I had to get those cortisone shots, and it didn't work out. Now I'm worse. So I'm not into the surgeries. I'm not into the cortisone shots. And you said you had a cortisone shot or two. How many total did you have?
2 in the right knee and 1 in the left.
Okay.
And
so that didn't do your knees any good. That hurts your knees. And I would never do it again. The way to do it is to inject some platelets.
Done it again, and they wanted to do surgery, and I said, no, I'm not doing surgery.
Okay, well, God bless you. I think that's pretty wise. So I'm going to give you the phone number to the office. It's 800-300-9300, 800-300-9300. It'd be great if you can come in. I'll take a look at your knees. I'm pretty sure I can help you. I can't promise it, but it's a lot easier to get an injection of cells from your body that can grow tissue rather than doing something that I think is dumb, which is injecting steroids, cortisone, and other things that kill the cartilage and give you arthritis. But that's up to you. You're allowed to do whatever you want to do.
No, I stopped. I knew it wasn't good, but at that time I had to keep working. I had to keep making money, and that was my only option. Now I'm older now, and now when I work, I end up on the bed for a couple of days just to recover because I can't walk.
I hear you. Well, God bless you, Joseph. You'll be able to walk again, I'm pretty sure. I can't promise it, but I think we could help you if you want. And I think we can grow back some of that cartilage in your knees, and I think we can help you alleviate some of the arthritis in there. But that's a choice for you to make. Everybody gets their own choices on this planet. And unfortunately, most of the choices that I see are surgical or medication that really hurt people a lot. In my experience, it must be doing some good for somebody, or the doctors couldn't keep doing it. And maybe I only get the failures that come in. I don't know. But there's sure a lot of failed surgeries out there. And Sally, thank you so much for hanging on there with us. This is Dr. Marc Darrow. I'm going to give out the phone number to the studio again so we can get some more callers. And this is Dr. Marc Darrow talking about stem cells and platelet therapy for orthopedics. And the phone number right now to talk to me live, as Sally is going to do, is 866-870-5752. If you're calling from your phone in the car, it'd be safer for you to pull over to the side of the road, get off your Bluetooth so we can hear you. And Sally, you've got a question about your fingers. Go for it. What's up?
Well, it's like my fingers, instead of being straight, it's like the index is a zigzag because it's growing a knob on each joint. Okay. And my thumb is also doing the same thing. What is the bottom line to do?
Have you ever seen a rheumatologist?
No.
I would do that. Get checked for rheumatoid arthritis. It probably isn't that because you're not like red and swollen and painful. It's more sounds like osteoarthritis. But
it doesn't hurt.
Yeah, it doesn't hurt. So it's probably not rheumatoid arthritis, which is good. I could look at it for you and let you know in a second. I would inject that with platelets and or stem cells and stabilize those joints. Often when we do that, those nodules go away too.
Okay. Okay. And you say you're going to look it up, or what?
No. I would need to look at you. Look at your fingers.
Oh, I see.
Just mail them in.
Where are you located?
Mail your fingers in. I'm located across the freeway from UCLA on Wilshire Boulevard, West LA.
Oh.
Very close to UCLA.
Okay.
It's a hop, skip, and a jump.
Can I call you back then?
Yeah, of course. Just call the office at 800-300-9300, and you can set up an appointment. Come right in.
800-300?
9300, yeah. We're going to the break. If anybody wants to talk to us after the break, call the studio at 866-870-5752. That's 866-870-5752. Nita, you got something?
Yeah, I do. Grab a pen or a pencil, write down this information. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.